to It's Your Case, brought to you by VetCT.com. I'm Heather Chalmers, your radiologist on demand for this week. Today's case is an almost 2-year-old male neutered cat with pelvic limb lameness and right hip crepitus after what the owners described was a short fall. Once you've reviewed the radiographs using your systematic approach, then you're ready to watch this video. For this case, I'll start with the ventrodorsal view, in which you can see we have the patient positioned in what we call a frog leg position. This means that instead of having the hips extended caudally with the femurs parallel, caudal to the patient, the hips are actually extended, flexed a little bit cranially with the knees forward, similar to a frog leg type position. This view can be excellent when we're assessing the alignment and the position of the femoral head and neck, as in this case. Let's compare the abnormal right side to the normal left side. You can see that on the right side, there's increased radiolucency in the region of the femoral neck, and there's a sharp margination between this and the femoral epiphysis. On the left side, we notice that this area is appropriately aligned, so when I trace the femoral margins, it all seems to be contiguous. However, what is abnormal on the left side is that there's an open physis in the proximal femur, which is unusual given patient age. Looking at the lateral view of this region, we can again see that there's increased lucency in this region and malalignment of the femoral head relative to the femoral neck. Therefore, this cat is suffering from a right femoral capital physeal fracture. This is a syndrome that can be associated with feline femoral neck metaphyseal osteopathy. This condition has been described in the literature, and we've provided several references in the associated report for this case. Essentially, spontaneous femoral capital physeal fracture can be seen in young male neutered cats, especially those who are overweight, and it's also associated, as we see in this case, with unusually delayed physeal closure in this location and others. Be sure to review the full report associated with this case. Thanks for listening, and remember, it's your case, so please post your questions on social media.